And welcome to Focus on Health. I'm Joe Gum. We appreciate you joining us. More than 90 million Americans complain of some type of back pain in the last year. Common causes include herniated and bulging disc, degenerative disc disease, and spinal stenosis. At Alliance Pain Centers, doctors use the latest technology and innovation to relieve back pain where others have failed. Dr. Jade Malay joins us now to talk more about non-surgical spinal decompression, and we welcome her right now. Thanks for joining us.
Thanks for having me, Joe.
Now let's talk about this because you've been treating patients for more than 15 years. How have you been so successful?
Well, certainly I've treated many low backs and necks over the years, but with this technology, the main thing is knowing exactly what the cause is. We must be sure that we are treating someone who has been officially diagnosed with herniated or bulging disc, spinal stenosis, or degenerative disc disease. And this technology that we have is amazing, it's groundbreaking, and many people have gotten their life back due to this machine.
Well, and many of those people that have come to you are excited because it's non-surgical. And a lot of folks are looking right now thinking, hey, that's great. How does it work?
That's exactly right. It is non-surgical. The name of this machine is the DRX9000. And how it works is when you have a bulging disc or any type of problems that we've mentioned earlier, what's happening is that disc is sick. It is dehydrated. So what this machine does is it gently separates the bones in the spine. It creates a vacuum so that any bulge that is there, it's able to retract back into the disc area, also bringing along with it blood, water, and nutrients that the disc needs in order to heal. So when this happens, the disc is actually expanding where it was shrunk before, which is what is causing the problem. So when we have expansion of the disc, this is when people start to see the results and are symptom free, and it's a long-lasting result.
It sort of reminds me of that toy we used to play with, the Stretch Armstrong, where you stretch them out until basically the gel breaks one day. What do you tell people, though, when they come to you and say, hey, I've tried everything?
Well, if they haven't tried this, they haven't tried everything. So if people have tried medication, they've tried physical therapy, they've tried even surgery, and if they haven't been to my office and been properly evaluated to see if they qualify for this care, well, then I welcome them into my office to do just that.
Should anyone with this type of pain, whether it's neck or back, come to see you for this?
Absolutely, because if your goal is to avoid surgery, then you are more than welcome to come into my office, be evaluated, have the proper evaluation, because a lot of people are out there, they don't even know what their diagnosis is. Yes, they have neck pain, yes, they have low back pain, but the diagnosis isn't clear. So the key to this is the diagnosis.
We know there are a ton of success stories, so tell us about one.
The one that really stands out in my mind is this young lady who came in and she had neck pain, but her debilitating part of her problem was that her arm was going completely numb. It was going so numb to the point where she had to get out of school. She was in college and she had to be released. And she had gone through everything you can think of, spinal surgery even, and that didn't even clear it up. So after evaluating her MRI, we put her on the machine, and after about 24 visits, she had complete use of her arm. She was able to go back to school and able to return to her life. And
I'm sure she thanked you on graduation day, if that's come around yet. Now, you talked about 24 treatments. Is that usually how long it takes?
That's typical. 20 to 24 treatments is what we typically treat with, and most people will see results within that time.
Now, is there anything that you want to offer our viewers today?
Yes, what I'd like to do is offer your viewers, for the first 25 who call, is offer them a free consultation. I'll be happy to sit down with them, meet with them, see if they first qualify for this type of treatment and are a good candidate for this type of care.
And no pressure, right? As far as the consultation, they just come in and you'll tell them exactly what you need to tell them, right?
Absolutely. Of course, I'll give my recommendations and we'll see if we can move forward and help them get their life back.
Okay, well, Dr. Malay, we appreciate you joining us today. And if you want more information and appreciate what she just said, well, guess what? The offer is out there, the latest in successful treatment of chronic back and neck pain. Call Dr. Jade Malay today at 972-492-0383 or visit the website at drjademalay.com. They can treat back pain or neck pain and sciatica, building or bulging or herniated disc, degenerative disc disease, and spinal stenosis. That number again is 972-492-0383. The first 25 viewers who call and mention this Focus on Health segment will receive a complimentary consultation. That's a $245 value. Dr. Jade Malay paid for this segment. We appreciate you joining us for Focus on Health. I'm Joe Gum.